Alright, let's dive into something that's been making headlines lately, and honestly, it's a topic that hits close to home for a lot of us. Millions of people in England are facing longer waits for mental health care, and here's the kicker: NHS providers are planning cuts to services and jobs. Yeah, you heard that right. At a time when demand for mental health support is skyrocketing, the system is being forced to tighten its belt. But here's where it gets really interesting and concerning. This isn't just about numbers or budgets, it's about real people, real lives, and the long-term consequences of these decisions. Personally, I think what makes this story so compelling is the disconnect between the growing need for mental health care and the resources being allocated to it. I mean, think about it, mental health services are already stretched thin. We're talking about key services like child and adolescent mental health care, talking therapies, and addiction support, all of which are on the chopping block. And it's not just about the immediate impact on patients, it's about the ripple effects. When mental health care suffers, it affects families, communities, and even the economy. What many people don't realize is that underfunding mental health today often leads to bigger, costlier problems down the line. One thing that immediately stands out is the timing of all this. Just this week, Prime Minister Andy Burnham announced plans to create nearly 200 community mental health centers by 2029. On the surface, that sounds like a step in the right direction, right? But here's the catch: if the funding for staff and services is being slashed, how are these centers supposed to function effectively? Mental health charities have pointed out that without proper investment, these ambitious plans are basically just empty promises. And that's the frustrating part: it's not about a lack of ideas or intentions, it's about the resources to make those ideas a reality. From my perspective, this raises a deeper question: why is mental health care so often treated as an afterthought? I mean, if you take a step back and think about it, mental health is just as important as physical health, if not more so in some cases. Yet, it consistently gets a smaller slice of the funding pie. A detail I find fascinating is that mental health services are particularly vulnerable during financial crunches because a large chunk of their budget goes towards staffing. So when cuts happen, it's not just about reducing services, it's about losing the very people who provide the care. That's a double whammy for patients and professionals alike. What this really suggests is that we are at a critical juncture. The NHS Alliance survey revealed that 68% of mental health trusts are likely to reduce or shut down services in 2026 to 27. That's not just a statistic, that's a crisis in the making. And it's not just about the numbers, it's about the human stories behind them. I've spoken to mental health professionals who are worried they won't be able to provide safe, effective care under these conditions. One consultant psychiatrist even said, anonymously, that many trusts are in a similar, if not worse, situation. That's alarming, to say the least. In my opinion, what's missing here is a long-term vision. Sure, balancing the books is important, but not at the expense of people's well-being. Sharon Graham from the trade union Unite put it perfectly: we cannot balance the books on the backs of the most vulnerable. And she's right. Cutting mental health services might save money in the short term, but it's going to cost us far more in the long run, both financially and morally. If you ask me, this is a wake-up call. We need to rethink how we prioritize and fund mental health care, not just in England, but globally. So, where does this leave us? Well, the government has pointed to record investments in mental health, £16.1 billion this year, along with 8,500 new mental health workers. And yes, that's a step in the right direction. But here's the thing, it's not enough. With demand rising and services being cut, we are still playing catch-up. The upcoming mental health strategy later this year will be a key moment to see if there's a real commitment to future-proofing the system. But for now, I'm left with more questions than answers. What do you think? Is this a problem that can be solved with better funding, or do we need a fundamental shift in how we approach mental health care? Let me know in the comments below. And remember, this isn't just a story, it's a call to action. Mental health matters, and it's time we treated it that way.